just have a few final words here. Just kind of more inspirational questions for you. Kind of the why me, why you, why are we all here? It's usually personal or professional why you're into something like this. Chances are you have been touched by a suicide in your life. If not, chances are you will be. It was once thought that one person's suicide affected 6 people. But thanks to a study by Professor Julie Sorrell, she's a president of the American Association of Suicidology, that number has been found to be closer to one suicide affects 135 people. That is huge. That is a huge village that we need to think about. We've talked, and if it's a Guard member, it's his entire unit, and it's their families, and it just trickles down. As far as for me, I have learned so much. My experience is pretty personal on suicide. But when I look back at professionally, I was trained to be doing this kind of thing. I was educated as a Bachelor in Science of Nursing. Through that education, I learned not to take things at face value, that if something's not right, you don't keep on doing the same thing over and over and over again without questioning that. You try to find a new answer and something else that will increase outcomes. And during that time, I worked primarily 25 years in pediatrics, and we educated patients, families, children, schools, the gamut. We looked at the whole environment for the patient. It was not just the patient themselves. I later worked with children with special health care needs, and those needs were different. And so education was different for people that have chronic health conditions. As a nurse, it was not just my job to teach people and to educate people, but it was an ethical responsibility to do that. And I think we need to get back to that. Even though a hospital system says we're doing it one way, we need to start questioning what we're doing and if we can't do things better. One of the things, and I've talked about the safety plan, and there's one in your packet. What that reminds me of is when I was working with an asthma work group. And I came back from CDC, and they had these asthma action plans. And everybody needed an asthma action plan. It lists signs, symptoms, medication, and actions needed when there was signs of an impending asthma episode. Not only was it good for the child that had it, but it was good for the people next to them to know what to do. It was the standard of care. It wasn't just something that, maybe somebody should fill out. What we ended up doing is creating legislation, because what was happening in our state is not all kids in all school systems were allowed to carry their emergency asthma medications or epinephrine with them. So legislation went through, and now kids who are trained got to carry their medications with them if they had an asthma action plan. You guys, this is just a no-brainer to give everybody a safety plan, a written safety plan. I don't know if it's a blessing, but I had the ability to read my son's medical record. And as a parent, my heart dropped. As a nurse reading it, my heart dropped even further, because there's huge gaps in that medical record, the things that weren't done. I guess that's probably where my anger has been directed at. A social worker mentioned a safety plan. His safety plan was to call his mom or his wife. There was no written document. There was nothing to help him look to see, this is what I need to do, these are my strengths, this is when I need to call. There was nothing. And I picked him up at the door of the unit when he was discharged. They gave him his phone, they gave him his keys. That was it. I was passed a baton and had no clue how to run. I had no clue how to help my son. Just because I was a nurse, it's your own family. You're like a deer in the headlights. So we just need to get to that point where we raise the bar. Maybe we even pick up the silly bar, because I just don't think we're doing it. I believe I can say with 100% certainty that the words, "they lived a good life," have never been uttered at the funeral of someone who has died by suicide. And that needs to change. We need to stop having suicide. The Suicide Prevention Coalition today is really hoping this day will spark a passion inside you to partner together with us to help create changes in our mental health system. Personally, I pray that that happens to you. I pray that we have sparked that passion before that passion finds you like it did me. Folks, there is a saying that it takes a village to raise a child. I also believe it takes a village to save a child. And please think about being part of that village for us, because it's all needed. We're all doing great things, and there's lots of great minds here, and we just need to come together. Thanks for being here. Safe travels home.